So it's my pleasure to have the opportunity to introduce the next speaker. Before I get into that, and I'd be remiss if I didn't acknowledge all the hard work and effort that Nishan's put into this program. I've heard a couple of people acknowledge me and give me credit, and I will vehemently deny that I deserve any of it. So Nishan is the engine, the motor. He has put this together the last 2 years, and let's just give him a big hand before I forget. So we're delighted that PANP has reinvigorated our presence the last couple of years, and this event has really become our signature and something that will, I think, help us to leave a lasting legacy and continue on. And we hope that the scholarships are going to get bigger and better, and I do expect we'll be able to start making meaningful contributions to our community as well, which is great for all of Niagara and all the communities that we serve. So all very exciting. But that was me going off script and over time. So my real job for the moment is to introduce our next speaker. And our next speaker really in Niagara should really need no introduction, Sherry Torkos. Sherry, incidentally, went to the University of the Sciences in Philadelphia for pharmacy school, which is a fun fact that I did not know prior to this. But what I do know is that Sherry is a wonderful, engaging speaker, extremely knowledgeable in all things pharmacy, with a special interest in natural health and natural remedies. And we're very pleased to have Sherry to come up and speak to us today.
Good morning, everyone. How's everybody doing? Everyone's caffeinated? Well, it's nice to see you all here this morning. A lot of familiar faces. Donnie was my preceptor when I was a pharmacy student, gave me the first opportunity in the Boggio family, and I'd like to thank him for all that he's done to guide and help me in my career. And to thank as well Nishan and Sean. Okay, Nishan for organizing all this, Sean for the introduction. But no, it's great to see a lot of familiar faces. So when we hear the term head lice, how many of us have that natural reflex where we feel like scratching our scalps, right? And how often have you been in the pharmacy when a parent has come in frantic? I think my kid has head lice, or I got the letter home, my child has head lice, can you take a look? And of course, when I was at the pharmacy, the technicians were like, okay, Sherry, this is for you over there. Nobody really wants to get involved and do the dirty work, right? Well, head lice is not a dangerous occurrence, but it's one of those conditions that is very frustrating for families. It's time away from work, time away from school, sometimes failed treatments, embarrassment for children because there's still a lot of stigma around head lice. And we'll talk about that. We're going to dispel some of the myths. So what we're going to do this morning, I'm going to go through some facts about head lice, talk about the available treatments, what works, what doesn't, and also discuss an important issue, which is something that needs a lot of attention, and that is the issue of resistance. So that's where we're headed today. So head lice have been around for thousands of years. This isn't a modern day phenomena. In fact, if you look back to the times of the Egyptian mummies, they found head lice, remnants of head lice in their tombs. And even Cleopatra was said to have been buried with a very fancy gold comb in her tomb. So this is something that humans have dealt with for thousands of years. It's one of the most common public health issues facing children today. Of course, cough and cold is big. Head lice, I think, is number 2 in terms of issues that kids face when they're of school age. And there is a big financial burden to this because when a child is sent home, depending on the school's policies and district, they may have to stay home for a couple of days. Maybe that means time away from work for the parents, maybe visits to the pharmacy, probably, visits to the doctor's office, possibly. So it can be a real burden. In Canada, we don't have stats on the actual numbers, but in the US, where we do know, it's estimated to be about $500 million annually. So a little audience participation question. Which of the following statements about head lice is false? Head lice do not transmit disease. B, head lice infestations are more common in children than adults. Head lice can jump from one person to another. Head lice survive only on the human scalp and die within 2 days without a host. What do you think? I'm hearing some B, some C. Okay. And the answer is C. Head lice do not jump. They don't fly, but they do move, and they move fast. Okay, so what is head lice? So we're talking about this little critter, Pediculus humanus capitis. So it's a tiny wingless insect, lives and breathes in the scalp, kind of like vampires sucking on our blood. They need that continual blood meal to survive, and without the blood meal, they do die. So that's their only source of nourishment is human blood. And when the louse is attaching itself to the scalp, it actually infuses some of its saliva into the scalp as it's sucking out the blood of the host, which is really disgusting when you think about it, but that's what happens. And that's why often people that have had lice, they get sensitization reactions. It's itchy, their scalp's itchy because of the crawling feeling, but also the reaction to the saliva from the lice can also cause that reaction. So this shows you the life cycle of the head lice. It's 30 days, and it's important to understand this life cycle because to effectively treat head lice, we need products that target every stage of the head louse life cycle. So you have the egg, which then hatches to the nits, the empty eggshells, the nymphs, which are like the teenager stage of head lice, and then the adult lice. So a few days after mating, the female can produce eggs, and it's unique. Their habits are unique in that the female can actually store sperm. So she has 2 ovaries, they alternate in producing eggs. Once they copulate, the female can store the sperm, so it's like one and done. She doesn't need to keep the guy around after that. But if they don't participate in the separation, one of them will die and then the other will die. So both have to take part in the separation process. So the eggs are laid close to the scalp, at the base of the scalp, and the female secretes a cement or glue-like substance, and that's what attaches the egg to the hair shaft. And that's why it's also very difficult to get them off the hair by just doing a combing. You need something that will loosen the egg away from the hair shaft, loosen that cement glue substance. So the embryo develops inside the egg, takes about 7 to 8 days, and then the egg hatches, and then you've got the nymph casing. So that is the nymph, and there are 3 nymph stages, occur over 9 to 12 days. And the nymphs do not bear risk of infection because the female nymph cannot lay eggs. So this is just the intermediate stage. There's the adult head louse, up close and personal. So you can see they've got 6 legs, and they have bent claws on the end of the legs, and that allows them to propel their way through the scalp, and of course, making them very fast as well. And I think there's a lot of misconceptions that they can fly and jump because they do move so quickly. And when you see them, and then it's like now you see them and now you don't, because then they just take off so quickly. So the adult lives about 30 days, and again, without that blood meal, the adult will die. So this slide shows you the respiration of head lice, and the reason this is important to understand is that the most effective strategy we have for eradicating head lice and the eggs is by penetrating this breathing apparatus. So head lice breathe by passive diffusion. There's 4 respiratory openings that you can see identified there. But the egg also has respiratory openings called aeropiles. And the aeropiles allow for gas transfer as the embryo is developing. And so that's really unique as well, because a mechanism of killing the egg is penetrating that breathing apparatus, leading to suffocation and death. So in terms of transmission, there's a lot of myths about transmission, how it happens, but it's usually direct head-to-head contact. And that's why girls are more often infected with head lice compared to boys, because young girls sit closer together, they're more cozy when they're talking to each other. Boys have shorter hair. Yes, they rough and tumble and play, but they don't usually get their heads as close. Now, head lice can be transmitted by sharing combs and hats and things like that, but it's not very common because it would have to be a rapid transmission. So a girl combs her hair, there's lice, the other girl uses it right away because, again, away from the human host, the lice don't live very long. But just to be safe, we always advise that they not share those objects. So the most common symptom is that feeling of something crawling through your scalp, maybe sensitization reaction from that saliva. That can cause kids to scratch. Sometimes they scratch a lot and they can get broken sores on their skin, in which case maybe we have to give them a medicated shampoo, a corticosteroid, or something like that. So the most common sites where you'll find head lice are just around the base of the scalp, around the hairline, behind the ears. And when we are talking to parents about how to identify, if they're not having us do it in the pharmacy, recommend that they wet the hair, section it off. It's difficult to see the head lice with more fair hair because of their color, so wetting the hair makes it darker, easier to identify and see. So good lighting, magnifying glass is also helpful. So if there is the presence of a visible knit, most likely there's an infestation, but if you see one or more active adults, then we know for sure there's an infestation. And it's kind of like mice or a mouse in the house. When there's a mouse in the house, there's never just one mouse in the house. There's many. Same thing with head lice. You find one, and there's likely dozens of them. Maybe you just haven't seen them all. So we do need to treat them. So this is a case study that we're going to go to. This, I think, is something that a lot of us can relate to. A mother comes into the pharmacy very distressed. Her 7-year-old daughter has been sent home with a note from school that she has head lice. She's used permethrin twice, but the lice are still present. She's stressed out, panicking, what to do. So these are some things that I'd like you to keep in mind, and then we'll revisit this as we come back to our case. So what additional questions might we want to ask this parent to determine the cause of treatment failure? Maybe some alternate treatments. How can we educate her on proper lice removal? And then let's talk about maybe some counseling tips that we could share. So the guidelines have changed a lot since I graduated in '92. Back then, we were told when there's somebody that has an infection or infestation, we treat the whole family. The guidelines currently are you only treat the infested person. So that's often a relief because if you have a family that has, say, 3, 4, 5 kids and you tell them you have to treat the whole family, they're like, oh my goodness. Like just the thought of going through this twice with one child is enough. So that is the good news. We only treat the infested child. So which of the following treatments are insecticide-based? Dimethicone, isopropyl myristate, permethrin, or pyrethrin, or both C and D? Yep. So both permethrin and pyrethrin are insecticides or pesticides that have been used for the treatment of head lice for decades. So these are the options that we currently have for treating head lice. There's the manual, which is the combing through, and there is some evidence that if done properly, wet combing can be effective, but it has to be done very thoroughly, very meticulously. It's not a one and done. You need to do it every couple days, and that's why it's often a hard sell for parents just to do wet combing, because in order to break that life cycle, get all those eggs, they often have to wet comb repeatedly. Chemical products, the pesticides, permethrin, pyrethrin, which I just mentioned. The physical methods, so these are methods that work differently, physical methods of destroying the head lice, and one of them works as well for the eggs. There's also a never-ending list of home remedies, and I'm sure you've heard some of these in your pharmacies, right? Parents will say, well, I saw on TikTok that coconut oil works, or I heard that we can use lavender, and I'm very holistically oriented, so whenever there's a natural or holistic thing that's evidence-based, I say, great, let's go for it. But really, there's very little to no evidence in that area. So this is where we get the term nitpicking, and that is from the tedious process of picking out the eggs. And primates might like doing this with each other, but as for parents that have a child with lice, often they are just like stressed right out, and it's the last thing they feel like doing is picking out head lice. So permethrin, this is the oldest product commercial product that we've had for treating head lice. And permethrin works by disrupting the nervous system of the lice. It disrupts the sodium channel, which regulates the polarization of the nerve cell membrane, and then that leads to paralysis and death. And it's been around for a long time. I think it first came out in the 70s and was used commercially in the 80s. It also used to be used as a pesticide for spraying on crops to kill other insects. But then it stopped being used for that purpose once they found out that it also killed bees, which of course farmers need for pollination. So permethrin, when it first came out, was very effective. So we're talking in efficacy in the 90s, not high 90s. And then its benefits have dwindled, or its efficacy have dwindled significantly to as low as 13% in one study that was done not too long ago. And what we're seeing is that, like with drugs that we have, antibiotics, bugs are adapting, the lice are adapting, changing, and becoming resistant. We'll talk a little bit more about that in a few minutes. So permethrin is considered safe. I don't know if it would be approved today. It's like one of those things that's been around for so long, it has a long history of use, but it is a neurotoxin, and it can penetrate the nerve cell membranes of humans as well, whereas pyrethrin, which we'll talk about in a minute, is specific to insects. So how this product is applied is you wash the scalp, leave it on, you apply it 10 minutes, comb through, and then second application after 7 days. So RNC, that also works by disrupting the sodium channel. This is actually pyrethrin is derived from the chrysanthemum flower. So if you have families that are allergic to ragweed chrysanthemum, they should avoid this. It works more specifically on the nervous system of insects. It doesn't disrupt the sodium channel of humans, so it's more specific for insects, and so it's thought to be less toxic than permethrin. But because of its mechanism of action for killing insects, there is a high level of resistance as well that has been documented in a number of clinical studies. So pyrethrin RNC applied to the hair, leave on for 10 minutes, comb through, second application after 7 days. And depending on the study you look at, efficacy could be around 50%, but very little to no efficacy on the eggs. So isopropyl myristate, which is Results, this came out, let me see, it was before my son was born. Everything is gauged to when I had my child. I think this was around 2007 when it came out. And it was great when it first came out because it was a non-pesticide treatment. It was a physical method of killing the lice. And it does work fairly effectively at killing the lice. However, it has little to no activity in killing the eggs. And the problem is, if we don't kill those eggs and get rid of those eggs, all it takes is 1 or 2 to get past that process, and then an infestation can recur. You get into that cyclical problem. So efficacy, I mentioned, safety for 4 and above. Because of how it works, it's generally very safe, well tolerated. 2 applications are also required with isopropyl myristate. So dimethicone, which is NIDA, this is the newest product to come out for treating head lice. And it came out, I think, in 2012. Works very differently compared to the other products. The Results works by dissolving the exoskeleton of the adult louse, causing dehydration and death. NIDA, or dimethicone, works by penetrating the breathing apparatus of both the lice, whether they're adults, nymphal stage, or the eggs. Because remember earlier I was showing you the breathing apparatus for the eggs, the aeropiles, where there's that gas transfer. Because of the chemical properties, the physical properties of this dimethicone, which is like a silicone-based ingredient, it penetrates those aeropiles and causes suffocation. So it kills the eggs, nymphs, and the adults. So efficacy has been deemed to be 97% after second application at day 9 in studies. 100% effective at killing eggs, which is really the big claim to fame, I think. High efficacy for adults and nymphs, but 100%. There isn't anything else that comes close to that in terms of its ability to kill eggs, and I'll show you some of the studies on that. It's safe for 2 and above, like most products. It's recommended that you apply it to the hair, massage it through, comb it out after 30 minutes, and then it has to be left on for 8 hours in order for it to have that 100% ovicidal activity. So that's the only tricky part with NIDA, is it has to be left on for 8 hours. So what I often tell families is if the child's home from school, you can apply it, leave that on while and then wash it out before they go to bed. But if they're going to school the next day, you could also put it on at bedtime, put a shower cap, or put a towel on their pillow, and then wash it out the next morning. So this shows results of a randomized controlled study that was done looking at efficacy of dimethicone versus permethrin, so NIDA versus Nix. And this was a study that involved 145 children ages 5 to 15 in an endemic area where there was an infestation. They grabbed the kids, brought them to another treatment site. They did 2 applications, and they looked at the efficacy of the products at day 2 and day 9. Now, at day 2, we saw the efficacy with dimethicone at 94% compared to permethrin at 66%. Day 9, very little change in the efficacy of permethrin, up to 97% efficacy with the NIDA. So question often comes, well, I thought permethrin was as low as 13% efficacy, so what about this? This study was done years before the most recent data on the resistance, showing the high level of resistance with permethrin and a lower level of activity. But I just thought I'd show this for comparison's sake. So ovicidal response, this was done through a hair tuft bioassay where they took hair tufts that had eggs on them. They exposed them to either permethrin or to the dimethicone for an 8-hour period of time. And then you can see that the dimethicone after 8 hours was 100% effective. So some of the other treatments that we hear about, again, mayonnaise, coconut oil, things like that. There's a thought that if you put, say, Vaseline or coconut oil, it'll work similarly to dimethicone, suffocating the lice. But there isn't any evidence, any clinical studies, maybe some case reports that these products actually work. I do get questions from parents, what about tea tree oil? Because I read tea tree oil is great, and I love tea tree oil. I use it in a concoction to kill bugs outside my house. It's great for cleaning, it's a disinfectant, has some antiviral, antibacterial properties, but there isn't any good science to say that tea tree oil is effective or safe as a preventative or treatment for head lice. The data just isn't there. Other things that are promoted for head lice treatment, things like kerosene, which sounds completely crazy, right? But believe it or not, 30 years ago, I have a friend who was in the army in Israel, and she told me that's what they did. When there was a lice outbreak, they put kerosene on their scalps to get rid of the lice. I thought that can't be true, but apparently it is true. So there is some evidence. There is one commercial product that is partially it contains coconut oil and star anise oil, and that does have some decent level of activity for killing lice, but it requires 6 to 8 applications. So it's sometimes a hard sell. You're lucky if you can get a parent, right, to do that application twice and do the nitpicking and the whole process. So sometimes asking them to do something 6 to 8 times is not something conceivable, right? So this shows you a comparison of the products that we just went through. These are the pharma products. All products require 2 applications, all the pharma products. And even NIDA that has like over 94% activity after 1 application. In certain countries, I think it's in Europe, where it is approved for 1 application, but in Canada, their Health Canada NPN or product information monograph recommends those 2 applications to get that 97% efficacy. This shows you also a comparison in ovicidal activity. Dimethicone is fully ovicidal. You have partial ovicidal activity with some of them, and then pretty much no ovicidal activity with the isopropyl myristate. Adverse effects, most of them are fairly well tolerated with the exception of the insecticides, which can cause burning, scalp irritation, sometimes rash, and potentially neurotoxicity with permethrin. These are the natural products that are available, although in your pharmacies, do any of you have these products like Nix Ultra? Does that sound familiar? Zap, that's another one that's out there. I'm not sure if that's something, seen Zap. Okay, there is some evidence for Zap, but again, it does require multiple applications, so that's a bit harder of a sell. So this shows you a map that is several years old, but shows you the level of resistance that's been reported worldwide. The R is the areas where you have very high levels of resistance. And so when we're talking about head lice, something that's used to measure head lice resistance is something called knockdown resistance. And so this is where you have point mutations in the lice. So which factor has contributed most to the rise of treatment-resistant super lice in Canada? Is it increased travel and exposure to different lice strains? Overuse or misuse of over-the-counter treatments, poor hygiene and lack of regular hair washing, or failure to follow proper treatment guidelines? What do you think? I'm hearing some D, some B. The answer is B. The overuse and continued use of the over-the-counter insecticide-based treatments. Again, we can liken it to the antibiotics. Things like amoxicillin or whatever, that the cephalosporins, they first come out, they're highly effective. Decades later, the bugs morph and change and become resistant. So most head lice that have been found and studied in North America carry this gene mutation that makes them resistant. It's a point mutation that causes target site insensitivity and failure of binding of the product. And that's what is leading to a lot of these treatment failures. In some countries, some areas of the world, there is 100% resistance. So Australia, Turkey, England, and Israel have identified 100% of these knockdown resistant gene frequency. So 100% of the lice sampled have this genetic mutation. So this helps us to understand why sometimes we get parents that come in and they say, I was careful in combing, I used the product as directed, and my kid still has head lice. Most likely because of this issue of resistance. So going back to our case study, the mother that comes in with the 7-year-old in a panic, what do? I've used permethrin twice. What additional questions would we ask the mom to determine the cause of treatment failure? I think. Quiet bunch. Well, maybe did you use the product properly? Did you follow the directions? Did you leave it on 10 minutes? Or if, how did you use the product? Did you use enough of the product? Maybe she thought, well, I have another kid and maybe I'll use some on my one kid and some on the other kid, so maybe it wasn't left on long enough. What alternative treatments could we recommend? So we've tried the insecticides, not working. The other options that we have pharmaceutically would be isopropyl myristate or the dimethicone. So maybe taking a few minutes to talk to the mom about the differences. The isopropyl myristate has about an 82% efficacy rate at best, but it doesn't kill the eggs, so she has to be very meticulous in the nitpicking and removing of those eggs. Dimethicone, advantage, 100% efficacy on the eggs. Disadvantage, you have to leave it on 8 hours, but I think with counseling, a lot of parents are okay with that. It's a little bit more expensive, so are we able to call the doctor and get a prescription for it? If they're buying it over the counter, it is more expensive than the results. So sometimes we need to have a dialogue, have a conversation about that, because it is the more expensive product, but is also the most effective product. So I know in my experience in talking to families, they are often totally willing to pay a little bit more to have something that has a much higher efficacy, because they don't want to go through that whole thing again. They don't want to have their kids sent home and have to do the treatments again and the embarrassment of the whole thing. So I always liked to reassure families too when they had that, they come up with that private conversation and you can tell they're embarrassed. It's like, my child has head lice, they're saying it quietly. I always would take time to say, you know what, this is so common, don't be embarrassed. Not a reflection of poor hygiene or anything like that. Lice don't care whether your hair is freshly washed or 2 days oily. They don't discriminate. It affects families amongst every economic level. So there's a lot of stigma around the head lice, but there shouldn't be. Common infection. We want to take time to review the instructions on how to use these products. Discourage the use of the insecticides because of the level of resistance that we now have. Using a proper comb. If you have a child that has thick hair, curly hair, I would recommend suggesting to the mom to get one of those metal combs, because it's really hard to use those plastic combs. Often the tines will break with thick hair or curlier hair, so a good lice comb is important to have. And if there's skin irritation or lesions, maybe an over-the-counter medicated shampoo or product to help soothe an itchy, irritated scalp. So in terms of the home care measures, they've also changed a lot since I started practicing. You know, back when I first started practicing, fumigating was recommended, and cleaning the whole house. But now we know the lice only survive at max 2 days away from the human host. So we advise families clean their bedding, clean their clothes that they just wore. If they were sitting in a certain area of the sofa or laying down, vacuum it. If there's things that you can't clean, you can put them in a bag and put them away for a few days, but you don't have to do a super deep cleaning of the house to get rid of head lice. And head lice also don't pose any risk to pets. They're infected by different insects. So that question often comes up, you know, my kid was snuggling with our dog, and now what do I do? Could the dog have lice and reinfect the child? That doesn't happen, so that's a sigh of relief. So lice, we're just going to wrap it up here. Well, I'm close to my timeline, I see. Well, it's unpleasant, it's treatable. That's the good news. This is an easy to treat condition. So spending some time in the pharmacy aisles to chatting with parents about what they can do to manage head lice, I think, is crucial. Hopefully in the very near future, pharmacists will have the ability, this will be added to the minor ailments, which would be great, because patients don't need to go to their doctor and waste the doctor's time and energy. They can come in, we can recommend, prescribe products, and it kind of makes sense to me, and hopefully it's going in that direction where this will be added soon to the minor ailments. So thank you for your time.